Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And today we have with us another special guest, and he goes by the name of Dr. Alejandro Badia. Now, this was an awesome episode. You know, Dr. Badia is a advocate for the healthcare system, and he's dedicated his whole life to it. He's a hand surgeon, got into a practice, found his way, ultimately started his own practice, became a big thing in Miami. And he's been very successful, practicing for over 15, 20 years. Now he's at a point in his life where he's sharing with the masses on how to even look at surgery. You know, for example, if you're experiencing hand pain and a primary care has looked at it and given you a diagnosis, what's really going on that supersedes, and not supersedes, but what's really going on that dives even deeper and gives you an understanding that maybe your primary care physician doesn't even have. This is the kind of work Dr. Badia does, in addition to providing a level of healthcare service that kind of bypasses the challenges of working with Medi-Cal and Medicare that so many practitioners experience. It's a jam-packed episode. We talk about social media. We talk about being a hand surgeon. We talk about medical sales reps. We talk about the state of healthcare. We get into it all. It's one of these episodes that if you're a surgeon hearing this right now, tune in. If you're a medical sales rep, you already know you have to listen. And if you're someone that wants to get into the industry, this will only do you a good service and a favor of listening. So as always, we do our best to bring you guests that are doing things differently in the medical sales space. And I really hope you enjoy this interview. So give us the story, you know, with your yah and everything. Talk to us.
I don't know if you know, but I'm a proud immigrant. I just heard a podcast with Scott Sigman, who has another excellent podcast interviewing orthopedic surgeons, and there was a guy from Iran, actually Iranian Jew, who escaped, and his was much more impressive because he came, as 17 years old. But I came as a baby, settled in New Jersey. Family in Cuba were many physicians, so I had that in my DNA. My dad started education all over, electrical engineer. He had to start school all over, so I always admire what he did, studying nights, having two young, babies in this country as an immigrant. But it's a typical story, right? Mm-hmm. So that story is important because my grandmother, my paternal grandmother, who's from Valencia, Spain, my entire family still lives in Spain. My dad's side lives in Spain, and she had horrible rheumatoid arthritis, and I remember she liked to sew, and she got to the point where she couldn't do it, and so anyway, at some point. I was about 8 years old. We went to Columbia Presbyterian, and I remember that day very vividly. And I sat in this office, and we went to see a hand surgeon, orthopedic hand surgeon, and he had all these certificates all over the room. Yeah. And we actually saw him not in like a patient exam, but actually his office. And I'm sitting there in a nice chair, my feet are dangling, can't even touch the ground. And I said to myself, "Wow, I'd like to do this." I don't know, but I was very close to my grandmother. So that was always in the back of my mind. When I did my orthopedics at NYU after my Cornell undergrad work in physiology, then I went to NYU for med school, and I stayed there because Bellevue Hospital was a main training hospital, and that was an amazing experience. Yeah. Very hands-on, of course, for residents. And when I applied for my fellowship, turns out that my main mentor in hand surgery in Pittsburgh, named John Briglia, had trained with that guy in Manhattan. Okay. So obviously some years after I was there, because I was only 8 years old. He's not that much older than me. Wow. Okay. But it was probably only a few years after that he did train, come to think of it. And anyway, so that person's name is Bob Carroll. Bob Carroll is like a full, almost a full one-page obituary in the
Sure.
New York Times that I remember reading. So I never got to tell Dr. Carroll the story, but in a way, he was my sort of grandfather of hand surgery, and the rest is
The rest is
history. I
history.
applied for
So,
upper extremity fellowship in Pittsburgh, so that was with John Briglia, and then I settled in Miami because that's like the Cuban Mecca, right?
so so much has changed in how medicine is practiced to what I'm assuming to what a med student expects life will look like versus what actually happens. I think it's transformed over the last 30 years. I think, and correct me if I'm wrong, but I'm thinking in the beginning it was, I'm gonna graduate, I'm gonna have my own practice, and I'm gonna do all these things. And I think now it's much more, I'm gonna graduate, I'm probably gonna join Kaiser or medical group, and I'm gonna work from 9 to 5. So I'm playing, but take us to when
No, that's
you.
that's true, but I think that some people believe that the pendulum is potentially swinging because physicians, now granted, this generation could be a bit different,
Sure.
but we tend to be a little more independent minded, right? We don't we don't need somebody. I mean, we just to get through organic chemistry and then get into med
Right.
school, you have to be somewhat independent minded, and when you have let's face it, a bureaucrat or somebody kind of telling you what to do, that doesn't go well with physicians. So I'm not sure how bad it's going to have to get before doctors will revolt. I'm seeing the underpinnings, and in fact, I want to proudly announce, maybe the first time in sort of a podcast, is that I have a partner coming, who is entrepreneurial minded. He saw this. He's had offers from big hospital centers, and there's nothing wrong with that. But why does somebody else have to control your destiny?
So let's
Um,
talk about it. I wanna highlight this issue. But our
yeah,
listeners, some of them want to get in the medical sales industry. Most of them are medical sales professionals, and some of them are physicians and leaders of medical device and pharmaceutical companies. I want to highlight the issue that we're talking about. Give us just go back to when you were gonna right before you started practicing. What was your idea of what being a physician is going to look like? Were you thinking you're going to be a solo practice, or were you thinking to join a group?
no, I think coming out is very tough to hang a shingle. You could do that years ago. But I definitely didn't want to join. I mean, I did interview around with some big groups. I was in Pittsburgh. I was limited with funds as how many places I could go visit. Right? You're
Sure.
not going to sign or join a group unless you visit. And honestly, I just couldn't afford it. So I actually went to Houston. That was a big multi-specialty Kelsey Siebold clinic. And right away I said, "Oh, this ain't for me." They said, "Yeah, we need a hand surgeon, but if you don't mind, we'd like you to see, patients with back pain." And unless you're a spine surgeon, nobody likes to
Right.
see. So it's just not my field. It's not fair to the patient for
Yeah.
me as an upper limb specialist. So that was out. Then there was a group in New Orleans, on the other side of the bridge, Jefferson Parish, and they were like 8, 10 orthopedic surgeons. They didn't have a hand surgeon. So I looked at that, but again, I wanted to go somewhere to use my Spanish. And I joined a guy who was very busy. He was solo, and we created what was then the Miami Hand Center.
Hmm.
A year later, a third guy joined who came from academia, came from Washington University. And I talk about this in my book, I think in chapter 3 or 4.
Sure. Sure.
So you creating this group, and eventually became 5 surgeons. And you get 5 surgeons in a room. There's always going to be differences of opinion. So after 13, 14 years, I decided to start my own thing because I had a different vision. We were in network with all these insurance companies, which meant we had way too many patients. We're getting paid very poorly for each of them. And that's okay when you want to, in any specialty, you want to come out, you want to hone your skills, and that's fine. But, 15 years into it, I said, boy, you know what? I don't want to average seeing 80, 90 patients in a
Right.
day. What
So
I
so
was
you
doing.
went so you went 15 years in that model before
Yeah.
you said it's time to do something different. So I mean, I'd like to imagine that there was a pivotal moment that you said, okay, something's changing. Can you go
Well,
back and speak on that, or what did it not
yeah, well,
happen that way?
we had disagreements with mainly the most senior guy. So I was the first one, and I tend to be, I don't know. It's funny, I never saw myself as a rebel, but I guess that part of me was coming out then. I was the first one to leave. And as soon
Sure.
as I left, I mean, within 6 months, the two other guys left, and then the fifth guy. So we were all solo. Um, I don't know if it was a pivotal moment rather than I think in any profession or any job, you want to be paid fairly.
Right.
And what happens when you start looking at these contracts, these in-network contracts that these insurance companies we're giving, and we're like the top of the food chain in surgery. I mean, microvascular hand surgery is kind of the most specialized thing there is, just
very
about.
specific.
And it was absurd. I started looking at that, and by that point, I had done so much surgery. I mean, it's not like I felt like, okay, I'm really, fortunately well trained, had a lot of experience, had great partners. That was one thing that I missed going alone. But I was already very confident with my skills. And I said, I want to be paid fairly. And then I realized, and this is sad, I realized that where I was being paid fairly was mostly people coming from emerging economies, third world countries in many cases, the more affluent, who were coming to see me in Miami, because that's the great thing about being in Miami, right? It's not really an American city, right? It's like it's another capital of Latin America is what it is. And well, now it's a New York, haven, that's where I'm from. So I was kind of ahead of that curve, but I realized that those patients who were flying in, my competition was really, the Mayo Clinic, HSS in New York, where I was chief of hand surgery for a while, Baptist, which had a big international program. Sure. I said, what I'm doing doesn't require hospitalization. So I got to the point where I was basically doing everything in an outpatient surgery center. And I was able to give these patients a lot of individual attention, which they're not going to get necessarily when you go to the famous, the Cleveland Clinic, or, I mean, those are great hospitals. Don't get me wrong. But, if I'm going to scope somebody's wrist or, do a rotator cuff, I mean, do they really need a big, cumbersome, expensive hospital? I don't think so. So I started creating this model, and at the same time as I was working, I actually was smart about it for a change. I actually built the center while I was working at the other place, and then slowly started transitioning.
Okay, so what was the name of the other place?
It was called Miami Hand Center.
Okay, and so Ortho Now you started building, or Badia?
No. Ortho Now is interesting because that's an afterthought.
Okay.
But no, it was called. I couldn't call it Doral Hand Center because, to begin with, I was leaving, and people, how are they going to find me?
Right.
And I was solo, so I didn't feel right calling it, a center like that. So I had to put my name in it. And then I had I had lunch with somebody in Boston who actually gave me the idea of calling it Badia Hand Two-Shoulder Center.
Yeah, so that's where it came from. Okay.
Yeah, but now if you look around, Samuel, if you look around the country, a lot of hand centers, Philadelphia, Indiana, they all took. So somebody said to me, I remember early on, they said, you should trademark that name. And I go, that's silly. Oh my God, I wish I had. So now many centers around. Yeah. I started that. I literally started that.
Wow, now that I didn't know. That I did not know.
Well, it was actually a fraternity brother. It was his wife, who I'd never met, never seen her again. We had lunch, and we were throwing around different ideas, and she kind of came up with it, and I said, that's it. So Badia Hand and Shoulder was built. I didn't want to go backwards, meaning at Miami Hand Center, we had everything. We had a lot of diagnostics. We had a 2-room, tiny, pathetic little 2-room center that was unbelievably busy, more than small hospitals. Our best year, we did 4,700 cases in 1 year.
Wow.
All right, in a 2-room center.
Right.
Okay. So it would go around the clock many times. So I said, when I built my new center, I said, I can't go backwards. So I partnered with a very good company called Titan Health. And unfortunately, they sold to one of the big wigs. And that's unfortunate. That's consistent with what we see with healthcare, because I was very happy with them as a partner. And then we were recruiting other surgeons, which was incredibly hard. Doctors are I don't know. You could put it to them on a silver platter, and they don't see it. I'm kind of baffled as to why. But anyway, it was very successful. At one point, unfortunately, they were sold, and then we were physician owned completely. Obviously, at that point, I built my office, which is across the hall from the surgery center, called Surgery Center at Doral. And then, of course, all hand surgeons really want to have a hand therapist near them because it's a critical part of recovery.
Sure.
So we have a therapy center.
Got it.
Now, going to ortho now.
Yeah, where did that come in?
Okay, so that's an easy one, Samuel. What I realized as a hand surgeon, and then every other specialist who's listening to this podcast, think about this. When a patient comes to see you, how many places have they gone before? In my specialty, I would say an average of 2, some 2.5, I'd say. A lot of people 3, a lot of people 4. Wow. Meaning, if it's, if they're bleeding, it's significant enough, they go to an ER. Then the ER, if it's a work injury, they'll send them to an occupational health center. They can't do anything for them. Then they might send them to an orthopedist, but that orthopedist says, "Ooh, I don't really do digital nerve repairs." So now I'm the 4th doctor. Now think about the first 3 physicians. They all, need to be paid, but they didn't solve the problem.
Right.
It's like you coming to see me for an eye problem. Yeah, I'm a physician. I don't know anything about the eye, and then I'd probably send you to the wrong person because that ophthalmologist maybe doesn't really treat glaucoma. Maybe only does retina. Right. Because I don't know any better. So now, so that's the problem is with ortho now. I realize that not only the emergency room, because they're busy, they're taking care of really sick people. That's femur fractures, but ankle sprains, presentation of back or knee pain, simple hand injuries like I was seeing. All of those things were being treated in a very expensive and prolonged manner. So I started ortho now.
So what is the pricing model of ortho now? How is ortho now, a patient that needs those services, how is going to ortho now better than the traditional having insurance cover it and the like?
Well, no, with insurance. So ortho now is a network, and in fact, that's one of our challenges is some of the smaller insurance companies trying to get them to understand, but it's so hard to have a dialogue with those people. Even when you tell them that they're saving money, obviously. So ortho now is a walk-in center. We have incredible data analytics going back 14 years now, and the data shows that 70% of people who walk in or limp in to ortho now come in for pain. Mm-hmm. They're not necessarily injury. So we don't even use the term orthopedic urgent care because pretty smart people go, "Oh, I'm not going to go there with my knee pain that I've had for 6 months." Because it's not urgent. Right. But no, people like ortho now because it's so convenient. So the number one ICD code is right knee pain. Literally, right. It's that granular. Wow. Right knee pain, almost month after month, is the most common presenting diagnosis. Now it's not acute usually. Sometimes it is. Could be an ACL tear. We see soccer players or football players. But no, most of the times it's just a little meniscal tear, maybe some patellofemoral syndrome where they need a little bit of therapy. They might need an injection. So if a patient, if we're not on their insurance plan, the amazing thing is people will leave many times. And I'm like, wait a second, you're still going to pay a copay or a deductible, but they want to use their insurance. Right. And we'd like to be on all the insurance plans, but again, we can't because it's a hard dialogue. So those patients would pay somewhere around $250, $280. That includes an x-ray and an evaluation by an orthopedic clinician. I mean, that's pretty good.
Yeah. So then, okay. Because I'm thinking when you created Ortho Now, you saw the need. The business obviously did very well, and here you are today. But I want to understand what were patients seeing that they started to say, you know what, I'm going to Ortho Now. And then when did it become, in your eyes, a model that all these other surgeons should pay attention to and potentially replicate?
Well, so first I want to say that it wasn't, for a number of reasons, it wasn't all that successful. For many years, I was kind of hemorrhaging money, to be honest, but I didn't want to give up. I didn't want to give up on this dream. And I think that's the same with many startups. Part of it is you have to remember, I'm not a businessman, right? I said it. I'm not good with P&L. I spent a lot of money on healthcare and then I franchised it. Terrible idea for anything that's complex. It's not
Sure.
it's not a gym. It's not flipping a hamburger. It's specialty specialty care.
Sure.
So I franchised it, thinking that my colleagues would say, okay, I'm too busy to start my own ortho walk-in center, urgent care, if you will. I'll just pay. I didn't realize that my colleagues were not the really smart ones would say, oh, well, I'll just do that myself.
Right.
But they're busy. So most of the times they didn't do it. And then other people just didn't see it or didn't want to pay. Doctors don't like to buy from doctors. So all your orthopedic sales guys who are listening to this probably understand this. Doctors don't like to buy from doctors. So if you have a product that an orthopedist came up with, you're better keeping that low profile if you're trying to sell it to one of my colleagues. And it's unfortunate. It's part of what I call CATS, colleagues and collaboration, which is chapter 4 in my book. So ortho now, but it was little by little it was doing better. We got rid of the franchise model. We have a license model now, but I do want to make another announcement besides my partner coming, which is to Badia Hand to Shoulder. I have my first in-person meeting with two very forward-thinking healthcare, businessmen who are investor operators, and we're in due diligence now. So, so
exciting
if you're
things are
interested in ortho now, going national, contact me in 2 months because if we haven't. We haven't signed, but I think we're going to do it. These guys are very smart. They see the huge potential. I mean, the potential it's like limitless when you think about it. I mean, who doesn't need orthopedic care at some point?
Right.
80% of human beings have severe back pain at one point in their life.
Right.
80%.
Right.
Yeah.
Okay.
So, and that's one thing that we do. So.
Yeah. Okay. I want to capture one thing, like we said a little bit earlier, that there's issues within healthcare, just how it's ran. And we can go on at so many different tangents, but from a bird's eye, 30,000 foot view, how would you just state the issue with healthcare right now, today? What's the problem and why is it an issue?
Too many middlemen.
Too many. Okay.
That's it in a nutshell. So, you can be a little more granular with it, and you could say, for example, what is this obsession in our system with pre-authorization, with authorization? Once let's just say an insurance company or a referring entity, an employer who frankly should do healthcare on their own, but that's another story. But once somebody has shoulder pain, it's not too hard to decide who they need to see, right? Okay, you're an orthopedist. Okay, great. Do you do a lot of shoulders? No, I really, I'm a foot and ankle guy. No. Okay. But you shoulders. Once that person is, authorized or whatever, referred to me, let me do what I know how to do.
I see.
Now, that doesn't mean we don't need oversight because there are bad apples in any profession.
Sure.
Or, we do make mistakes, right? So you need some oversight, but to control costs, this concept of putting these little barriers or hurdles every step of the way, I now realize that part of the thinking is that people, again, whether it be patients or providers, which I hate that term, if there's all these hurdles, maybe we'll give up. But you know what? Doctors aren't like that, and if a patient has a real problem, they're not going to. So what's going to happen is you're going to make them spend all this time and effort and prolong something that can get more complicated because you have to jump through these hoops.
Gotcha.
So that is just one sector of the middlemen. The middlemen are sucking money out of the system.
Gotcha.
Completely sucking money out of the system. And when you have pediatricians, who are making, $120,000 a year after, 11 years of education and training and getting woken up in the middle of the night by a hysterical mom to make that kind of money. I mean, shoot, you're better off being a successful jet ski mechanic. I'm in Miami, so every time I get hit with those
No,
bills,
no, no. The visual was hilarious.
but
Okay, so
it's true. It's so many, I mean, it's so many, but the problem is that pediatrician or myself, the
yeah,
subspecialist surgeon. I mean, our reimbursements being impacted by all these people who
all the
are really
middlemen.
superfluous to healthcare delivery.
Why did it get here? Why do you think there are so many middlemen? What's driving that?
People saw the opportunity and they still do. I mean, there are people who realize, I mean, I'm not even getting into fraud. I mean, I'm embarrassed to say I practice in Miami where 50% of the Medicare fraud nationally is in this county.
Wow, I know that. I
In
did
this
not
county.
know.
Oh
Wow.
yeah,
Okay.
it's
Okay.
so that's just that. I mean, that's fraud, but it goes obviously fraud is a smaller part of it.
Sure.
But if you're anything that you're doing that's detracting away from the patient physician relationship is often going to be unnecessary. Let's just be honest. And I realize, there's opportunities and people, I mean, I look, I'm not knocking the orthopedic industry. The reps do very well, but a lot of them do better than the surgeons. And
Yeah, that's true. This is true.
And maybe that's our fault, right? The surgeons need to be a little bit weak, but so many of us have our head, with our patients, which I guess is what we should be doing, that we don't come up for air and look around us and say, wow, I mean, Medicare is going to pay me, I don't know, what is it now? I don't know, $1,400 to do a knee replacement. But what the public doesn't know, that includes 30 days of the global period, meaning if that patient, doesn't do well or they're a pain in the ass and they're coming to your office every week with some little complaint, you're not getting paid for that. And that's your time and your expertise, right? Yeah. So people think, $1,400. Okay, honestly, I look at it, I go, $1,400, you have to be a fast surgeon. You better do your total knee in under an hour because I know what it costs me to run my office per hour. I've done kind of the rough calculation. So it gets to the point where unless you're making a certain reimbursement, you're barely making money. And
would you say that this entire thing was driven by the agenda of the insurance companies, or was driven by the manufacturers, or was driven? Where would you? And I don't want to say blame, but I want the audience to understand from your perspective a clear understanding of what most likely was kind of driving this and continues to drive it. I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of.
Well, look, our own government is, I'm sad to say, is a big driver in this because CMS has been cutting, Medicare has been cutting reimbursements every year for 20 years. There's no other profession on the planet where you actually make less money every year, despite inflation, despite everything else, right? The problem is Blue Cross and that whole cast of characters all base the reimbursements on the Medicare rates. So once you drive the business down, then physicians got to the point where, I can't hang the shingle anymore. And then the hospitals who still get paid, they're struggling too in many cases, but they realize, let's just hire the doctors. And then that's what's happened. And then it's a vicious cycle because now you have many doctors who say, it's 5 o'clock, it's quitting time. That's That's not the spirit of private healthcare, private practice.
Yeah.
You do it, remember Marcus Welby?
Yeah.
Samuel,
Yeah.
growing
Yeah.
up, that kind of model of that dedicated physician,
It's kind of
we're
died.
losing
I
that
know.
because they're employed and they have to be employed because with reimbursements coming down, expenses go up. Expenses go up in everything. I have a couple guys working on my air conditioning here today. I mean, they're not cutting their rates in 2025, right? But in healthcare, we are. And so I think we're going to get to that. And I said it before. I don't want to offend any people, but it's just such a powerful statement when you say I can't breathe, and doctors are going to be saying that.
No, I get it. I get it.
Enough is enough.
So
I think it's going to happen.
no, I'm listening, and I receive everything you're saying. So now that that's the issue, and that's continuing to be an issue, what is the most, I don't know how to say it, but most successful solution you've seen so far for doctors to almost combat this continuing to happen?
Well, in the words of George Bush Sr., just say no, right?
Okay.
And I've done that, and I know the physicians who've done that are doing pretty well.
Sure.
We just have to say, you know what? We're not going to accept these rates. So
Okay.
it was painful for me because I go and I do medical missions for free, right? So obviously,
right.
I'm not like many doctors. I have a charitable, bone in my body, but I don't like it when Medicare. So that was the last straw. So last year I opted out of Medicare. So you want to see change? You see virtually every doctor say, "No, I can't do that anymore. I'm sorry."
So what's the challenge? So I'm sure there are surgeons who might be listening to this right now, and they haven't made this move yet. This move that you've made and some of your colleagues have made, and they're anticipating the challenges of making this move.
Yeah.
In your opinion, what's the biggest, if you say, you know what, I'm not taking Medicare anymore, I'm done with this. What is the biggest challenge you will face as an entrepreneurial surgeon?
I'm facing it now. Many people will just not come to see you. So that's the problem. If you don't have a reputation yet, people are going to say, okay, well, I heard you're very good, so I'm willing to pay something out of pocket. I mean,
Sure.
It is my hand. It's kind of important, right? So
just a little bit.
You'd be surprised how many people who actually have the money don't do that because we've been so brainwashed in this country.
Yeah.
I mean, just yesterday I sat with my office manager to talk about our health, our health insurance. I hate paying that bill because all of my staff, they have a deductible. Unless they have a really, significant medical issue, a lot of times we're not even using our insurance. But now our insurance apparently won't renew because they said we spent too much last year.
Wow. Yeah.
So,
yeah.
But I don't think Humana's, struggling, right? So now we're going with one of the other big ones. But what physicians have to realize is we have a skill, right? So yes, you might have to suck it up for a little bit, but if you treat your patients with compassion, you spend time with them, you're a good physician. It's a little bit difficult at first, but you can do it without that. You have to charge reasonable rates, but most doctors are aren't willing to take that. We're very risk averse.
Sure. Now you've done it though. I mean, you have successfully accomplished this and living in it.
Quite a few other people, yeah.
And one thing that is obvious, if anybody looks you up, and for those listening, please look him up. You'll see Dr. Badia. He's well known on social media, and that's kind of what I want to talk about now. Is I think in 2024, the level of whatever business you have going on that social media can play to your advantage is the most it's ever been. And let's speak specifically to what you're dealing with. Now because you're not, you're charging people directly, and you need to be more known for people to understand that you have this great service and you're better at it than, whoever else. You have to put yourself out there. How has social media played into your success that you experienced today?
Well, I think we're only seeing it more recently. I think I've been doing this for a number of years. And part of why I did it was really very well intentioned. I'm passionate about patient education, so I do medical education, meaning I'm in 2 weeks I'm speaking at a meeting in Cali, Colombia, and I've been doing that for many years. Even though I have zero academic title, right? I'm not even clinical professor anywhere.
Sure.
But you don't have to be, right? So you can do that. But the one thing that I think we neglect, and now it's changing, as you pointed out, what we neglect is educating the end user of healthcare. Who is that? The patient. So I could talk about, scapholunate ligament, injuries at a wrist. But if I can put it in simpler terms and explain to patients that, that so-called wrist sprain that they told you in the general urgent care by the family practice physician, well-meaning, who's not going to be able to pick that up. You have to know that there's a possibility when you fell, on a basketball court with your hand like this, that you may have torn a scapholunate ligament. So I explain to patients with graphics, with simple terms, what that is. Because, an educated patient is a better patient. They're going to be more compliant with care. They're going to seek the right person. It could be me or it doesn't have to be me. I want people to just not make all these steps to get the right treatment.
I love it.
And that is what social media has done. So now, you're right, Samuel. Now I'm starting to get people who then through social media will now find me. It's very easy. I mean, you just Google my name and you'll get my website. On my website, I answer personally. So if you it says Ask Dr. Badia, I answer. I pride myself on that. Yeah. I answer personally every single one. Now I copy. If it's an international patient, Susan's my international patient coordinator. If it's a local patient, either Raphael or Andrea will schedule them. If it's somebody wanted to come shadow me and observe, then there's somebody else. But I answer myself. So I think that physicians, if you want that kind of practice, you've got to be hands-on. Mm-hmm. So I'm checking my emails at midnight before I go to sleep, because there may be that patient who needs me, and I think it's a worthwhile trade-off. I think it is. I enjoy that practice of medicine because they didn't find me in a book. Right. They're coming to me because they did a little research, and that's very rewarding for a physician.
Absolutely.
And when they do well, I mean, I've had a phenomenal week, Samuel, in surgery. I was in New York. I got stuck in New York, and then I flew straight Tuesday morning. I went straight to the OR because I had 2 international patients and I couldn't move. Yeah. They had philanthropy. And they were 2 huge cases, and they just did phenomenal. And to me, nobody, no insurance company, no attorney, no bureaucrat can take that away from me.
Hey, come on.
And that's the one thing I think us doctors,
I love it. I love it.
Yeah.
How much time would you say, how do I want to say this? How much time would you say you spend on your social media efforts? And it's a 2-part question. When did you, what happened that you realized that this social media, to spend any time at all, is absolutely worth it? Like, what happened?
A few years ago, like I said, I'm starting to get a little bit of the ROI, so to speak, only in the last 6 months to a year. Okay. I had an unfortunate thing where I had a young, talented person who wanted to go into medicine, and long story, but I found she was actually better at that. She was very good social media, and she suddenly resigned. Didn't come in on wrote a letter literally Sunday night. So it's amazing how important it is to have people like that. So now we're kind of training internally some folks who are picking up the slack, but you have to be involved, and I always was. I mean, you cannot farm it out. So I have, I'm writing a I don't know if it's going to be an op-ed or it'll certainly be on LinkedIn, but I'm writing an article. It may tick some people off, but I'm talking about the prevalence of cottage industries in healthcare. And that's what I mean by the middlemen.
Okay.
I get 10, 15 messages a day of people wanting to do my social media. There's only so much. Right? But there's all these people and they're not free, right? So the question is, how much money do you have to do that, to get somebody who's going to, I don't know, put you on podcasts, for example. There's people who write to you, but when Medicare is cutting you every year, there's not that much left over. So
Right.
so the message to people listening, you got to do a lot of it yourself.
Mm-hmm.
That's it. And there's great people who do that. I mean, I mentioned Scott Sigmund before. Corey
Mm-hmm.
Calendine, you can look him
Mm-hmm.
up. You've probably seen him. Corey
Yep, my
does a
cat. Yes, I have.
phenomenal job,
Mm-hmm.
mostly with joint replacements, but he'll do other things as well. So
Mm-hmm.
so there are people out there doing it, but we're actually, unfortunately, a very select few. And I personally think that we should collaborate more, with the people who are doing that. And it's going to benefit everybody. It'll benefit other colleagues who aren't doing it. That's fine. That's fine. In the end, if it benefits patients, ultimately, I think healthcare costs can go down with this, because now people know the type of physician they need to seek, the type of treatment. And I think that's a win-win. And look, you and I, we're both Americans, right? We're almost 20% of our GDP is spent on healthcare.
Right. Right.
That's
No,
twice as much. Yeah, twice as much as the next country.
Yeah.
And that means there's less left over for education of our kids,
Right.
or the environment,
Right.
or what have you.
Right.
So
right.
these are really important issues, and I'm always
Right.
amazed that the public doesn't engage more with it. I make the joke, if I could get a cute cat and do something, a video with them, or I'm in Miami, find a sexy girl, which is easy. I just throw a rock and hit it in a bikini, and then I'll get a million views.
Right.
I wish we'd see more engagement.
But I think you kind of called it out though, in that Dr. Sigmund, Dr. Calendine, you guys are kind of driving the effort from the doctor's perspective of doing the social media and how valuable it can be. And as long as you continue doing it, I mean, let's be honest, everything is going this direction, right? I mean, once upon a time, LinkedIn was kind of cool, and if you had a profile to get jobs, great. Now it's a standard. It's a standard if you want to get employed, and surgeons are using it left and right to get the message out, and it's working. So I think everything's going the direction, and you just got to keep doing it, and hopefully that inspires. I really do believe the newer generation of surgeons are starting to see the value. I mean, I'm seeing guys in fellowship programs having a whole audience and a following, before they even get to their first, hospital. So it's things are happening. Now, in that vein, I want to talk about the time you spend. Would you say an hour a day, 2 hours a day, a couple hours a week? Just throw a number out there for those listening.
No, it's more than that. No, I'd say it's 1 to 2 hours, meaning
a day.
Just checking it. You're learning, right? Always learning. You get ideas from other people, but you also learn. I mean, I learn stuff even in my own sort of field once in a while, which is amazing.
Right.
But it takes time to put together, whether it be a video or a series of pictures about an interesting case. And then that's where my staff helps me.
Sure.
Because they could take that material and create it, but I'll often do the tags, right? Because I know what the tags are, better than they do. Yeah. So that takes my time. So you've got to be willing to devote some time. But I think it's a good thing. And like you said, with the generation coming now, it's going to be standard. It wasn't a few years ago.
No, it's standard now.
5 years, forget it. I mean, now you go to a restaurant. I know people who don't, look for a restaurant on Instagram.
You're right. I
still don't do that.
That's how important it is now. I even think COVID accelerated all of it. So it's so important now. Okay. So
we were all home. Yeah.
So you're on the Medical Sales Podcast, so we can't not talk about medical sales reps. All right, so let's go back, and I love what you said.
I was just with one about an hour ago.
you said what?
I was just with a medical sales guy.
Okay, there you go. There you go.
He's become a good friend of mine. We have to go pick up. It's thundering. We made it just in time. My boat was in for repairs as usual, and he helped me bring it back. But they're a vital part. He was helping me with a case that I have of a shoulder replacement that's got a little fistula, and he's doing a lot of wound care.
Okay.
Really so we all learn from each other.
I love it. Okay, but you said something that I hear a lot. So besides the Medical Sales Podcast, we have a whole program where we help professionals get into medical sales positions, and we train professionals to be the best of sales reps you can be. And we screen who we help. So a lot of people say, I want to make money. I want to work with the smartest people in the world, which are surgeons, and I want to help people, and that's great. But we often hear the money thing, and And we have to be careful because we have to say, okay, I appreciate that. Everybody wants to make money, but where is your heart? Where's your work ethic? And who do you really want to help? And then we get into conversations of, well, what industry, what specialty makes the most money? You said something earlier. You said you have reps that make more than surgeons these days. Talk to us about that. What is the specialty where you see that? And what is that actually like? You know, I'm sure they're not just a rep, just being a rep. It's probably an exceptional rep. So talk to us about who's making that kind of money and how are they showing up that allows them to experience what they're experiencing?
Well, first you have to be good, obviously. You just have to be good, meaning you have to know your trade. You have to know your implants and your devices. And for that, you really got to know. It's amazing how much in orthopedics the reps know. They know the anatomy. They know the pathophysiology many times. So it's quite impressive. But for them to get to that point, I think it's hard. Just even as a surgeon, is when you're doing it your own. In other words, you're like the plumber. There's only so many sinks that you can unclog, right?
Sure.
So the way the reps, just to use a very general term, but really is when they get involved in distributorships where they're doing multiple, hopefully associated products, because it doesn't make sense. You're calling on different physicians. You want to do something in a certain niche, and then you're doing different areas, and then you're hiring people because you can't be everywhere. So one of the things about orthopedics, which I think the public doesn't realize, is for many of the things that we do, there is somebody there from industry supporting the scrub tech, bringing the stuff, making sure it's sterilized appropriately, and then helping in the OR. I find them invaluable. I do a lot of shoulder replacements, and there's subtleties. I mean, there's the guy named Austin who has helped me with shoulder replacements, and it's totally invaluable. But the way for a guy like that to really make big bucks is he needs to expand, and then he can't be everywhere, so he's got to make sure he trains the younger folks or people to expand his net. And that's the slippery slope. If you train them but they're not really ready, then you're going to hurt your own business. So you got to be careful with that. And I'm seeing that a little bit now with a very big company I don't want to mention, but they've grown so fast that some of the people aren't necessarily quite as qualified to help me.
Yeah, take us there. Take us to what that looks like, right? Of course, don't name any names.
No, I say I have a regular, a regular rep from that company there, almost every week with me, right? And then they get so busy, he ends up going elsewhere. And it's not like my schedule's at known. I mean, I pretty much operate every other Tuesday, sometimes, sure. But every other Tuesday, I run 3 rooms, and I do multiple cases, right? So if that person prioritizes being there with me, but when they're not, and then they have somebody that they brought on, and that person isn't as experienced, that can hurt their business, right? Because there is competition, right? God bless. We're in the United States. We have, I love the free market.
Yeah, hey, it is what it is.
Almost every level, right?
Yeah, so, every single level.
So that's what I'm referring to. But in order to, everybody wants to do well economically, right? To do that, you've got to cast a wide net, but you've got to maintain the quality.
Sure. No, it's critical. I see that completely. So let's now I want to take it to, you're on social media, and it's giving you a level of publicity that allows people to not just know who you are and what your service is, but actually know more about the value of your services. So they're more educated as a patient. Medical sales reps are doing the same thing. They're putting themselves out there, especially the good ones. And it's almost like they're becoming more known too. You can see people doing this. I think one rep told me they have a really good social following. They went to one of those conferences with a bunch of surgeons, and the surgeons were like, hey, because they saw them on social media.
Yeah.
What do you think is it, in your opinion, is it realistic to be a rep and say, to get access to these surgeons that are difficult to get access to, whether they're private like yourself or hospital, I'm going to make a profile, I'm going to put myself out there, I'm going to spread content, and that's going to help me? Or do you think it doesn't quite work that way?
That's a good question. I never thought about it quite that way. What my gut response would be, if they're educating the public, right? Because it's out there, right? But obviously your target, and you can, and with with hashtags and links, you can kind of focus it a little bit. But if you concentrate on explaining how that particular product fits into the whole ecosystem, it could be better than others, or just different, or certainly comparable, maybe better price. Then there I think there is a role for that. And like I said, I learn a lot from the orthopedic industry guys. So I think that's fine. I think that's a smart approach. I mean, obviously, you just commented on somebody who was, has become a bit of a celebrity amongst colleagues. It's the problem with social media is you don't often know, because most people go through it quickly and they're not necessarily liking stuff. I like when people share. Like if people like this podcast, to me, what's valuable is it takes just as much time to click share to your group as to like. Like is like, I don't know about you, Sam, but I don't have that big an ego.
You hear that,
I do
bro? He's telling you guys to share. Please be listening.
Yeah.
Go ahead, doctor.
Because that's how we spread the information.
Right. Yeah.
Right.
Yeah. Yeah. It's
Right?
true.
So
It's true.
And if somebody in the industry world is passionate about a product and point out what the differences are, then surgeon users would see that. But and even some of their patients, what the driving force is for me in a particular pathology that I treat, which is called basal joint arthritis.
Okay.
And I'm gonna give them a shout out because they're a wonderful small company.
Okay.
There's a company in Port Huron, Michigan named BioPro. And BioPro for years has had this implant that was first invented by a guy who basically did, I think, the first total knee in the country. This guy was so ahead of his time. I mean, he died 20 years ago.
Wow.
And they're a small company, and they want to keep it that way. Very niche products in foot and ankle and hand and wrist. And they still do some joints for their loyal followers, to be honest. But they're never going to be, Stryker or Smith and Nephew or anything, right? But they have this product called the modular thumb hemi implant, and it's for basal joint arthritis. That is the most common site of osteoarthritis in the hand, and certainly the most disabling. You would not believe, if you go to any hand surgeon around the country, almost every one of them will say, we're going to resect the trapezium, which is a bone, to base your thumb. We're going to take a tendon. We're going to use it to weave and bring stability to it. You're going to be in a cast for a month. Yeah. I mean, it is one of those things where, yes, occasionally I have to do that surgery, but through a small incision to put in an implant, just like we do in the hip, which you walk on. Okay, you don't walk on your hands. My Cirque du Soleil patients walk on their hands, but other than that, the point is that why not do the dogma amongst us hand surgeons is, oh no, those implants fail, because there were some papers early on that weren't. But in Europe, if you have basal joint arthritis, in some countries, my colleagues have told me 80% of people get that implant.
Okay.
Now, that is something that you have to educate the public about. And I've done that. And this week, while I was stuck in New York, we had a lab, a cadaver lab. The local rep was here. One came down from Canada. The rep in Montreal came down with the surgeon, who was, I think, scheduling his first one for next week. So the point is that a lot of this advances occur because of social media, because it's, basically it's free, right? It's free. Right. Just takes a little time. And it's a patient driven. So most of the people who come to me for that aren't referred by their primary care doctor. In fact, I get almost no patients from primary.
Okay.
My patients come to me from other patients. And any doctor you talk to, and I'm willing to bet even my internal medicine colleagues probably would tell me that the best patients they get is really from other patients.
Wow. Okay.
So this paradigm shift that we're seeing of basal joint arthritis is really coming because of efforts I and a few others, but predominantly myself, in this country are making towards telling people why rip out the trapezium.
Wow.
There's a better option. So that's going to be patient driven.
Yeah. No, you're okay. So I hear that. I'm on board. But you being the target for a medical sales rep, what would you if you got on, social media? Oh, by the way, doctor, what is your most common platform? Just what is it? Which one?
I'd say it's even between Instagram and LinkedIn.
Okay, so let's say you get on
I
LinkedIn.
came late to TikTok, and I need to step it up with TikTok.
I'm right there with you. Okay, so let's get it. You get on LinkedIn and you
Yeah,
see a rep that's trying to get your attention.
yeah.
What would you need to see that would make you say, I'm going to give this individual a little bit of my time because I like what I see?
Where people just approach you honestly and say, you know, I followed your work, and I think this would be something that might be of interest to your practice. If you don't mind me, coming by the office or sending you something by email, maybe I like that. I don't like to do everything through, I don't like communicating a lot through social media because then you have to check. But that's me. So everyone's different.
Sure.
But I
Sure.
like email. So I usually tell somebody, send me a PDF of that product so I can send me maybe a short video in being used. But in the end, doctors, reps, we're all different people, right? I tend to be a very open, accessible person. I pride myself on that. I actually
Yep.
get upset when I've had staff in the past kind of block somebody at
Turn
the
them
front
away.
desk.
Yeah, yeah, yeah.
I
God bless
don't
you.
like that
God
at
bless
all.
you.
Yeah, no, but I teach my kids that. I tell them a great story. When I was at NYU Medical Center, and after the library closed at midnight, there'd be 3 or 4 of us, maybe doing biochemistry. We'd go to a small classroom, and there would be a guy walking, whistling Dixie, and cleaning the rooms and coming in. I would look at him, and I would watch his work ethic and his spirit.
Yeah,
And I
yeah.
said to my kids, listen, I
That's
admire
it.
that guy more than one of my surgeon colleagues who's
I
a
love it.
sourpuss, who's rude to people, who doesn't take
Mhm.
pride in his work, doesn't care about his closure, skin closure. It's, not everybody has the same opportunities, right?
Right.
But doing the best that you can and having integrity, that's what I try to teach my kids.
Preach.
And it's
Preach.
the same with how you treat, other individuals. So I tend to be, oftentimes a little too open because, you got to be selective with your time. But
Sure.
that's just me.
Okay.
But so remember, every doctor's different. So I don't think there is a formula, Samuel, about how to approach somebody with a new product idea. But you don't know until you try.
No, no, you're absolutely right. I'm going to switch gears a little bit. So let's go back to that medical sales rep and let's go back to your favorite medical sales reps. One thing that a narrative that exists in the medical sales world is, to truly be an asset to your surgeons, you need to almost live their lifestyle. So, whatever they're doing, you need to be doing. However busy they are, you need to be that busy. What would you say to that? And if you think about your favorite reps, is that true?
Well, listen. Physicians go into this. It's a calling. I wouldn't expect somebody in the industry side to necessarily have that approach. If they're being covered by one of their colleagues, their weekend is theirs. If the patient is not necessarily there, I like when they ask me, how'd that guy do? We did the total, that was really tough, that total, shoulder we did. That's important. But I don't expect, and I don't think most physicians would expect people on that side of the equation to have that kind of dedication. But certainly, you have to be, available, affable, all of those, accessible, all of those A's. What's important is that sometimes you'll show up for a case and the surgeon's not going to use your product. And that's happened to me several times with a particular product that, I literally apologized to them because their time's valuable too,
Sure.
but it just wasn't a good indication. And so I think you have to be willing to take it on the chin that way. But in terms of the dedication, I mean, yes, look, a lot of times they have to be there earlier than we as the surgeons to get their trays in, get them
Hmm.
sterilized. It's hard work.
Sure.
It's hard work, but I think it's rewarding because you are having a direct impact on a patient. I think it's very rewarding. Now, if you like to sit in an office all day and work on a computer, that's cool. But that's not for me, and I don't think most of the medical salespeople like that either.
Right, right. Well said, doctor. We're going to bring this to a close, doctor. Before I do, though, I want you to share, please, anything you have for our audience. Like I said, the majority of people listening are people that want to get into the industry, medical sales reps that are there, the leaders of the way, and of course, physicians. So Please, any message you want to share.
Well, I think you have to understand the whole healthcare ecosystem, and it's changing, and it is problematic. We touched at that at the beginning. Let me find a copy of my book here. Hold on. The only reason I want to give a plug to my book is because I think I do a pretty decent job kind of summarizing the different components. So this is something that you could find on Amazon.
We're going to put it in the show notes, folks. It will be in the show notes, everyone. Go ahead.
Perfect. And so so I'm happy to say that just this week we got it into a Google Books. So you can get it on Amazon, Kindle, or you can buy. I'm old fashioned. I like to curl up with a book, but this generation likes to. So the Google version just came out, but it's like $6, I think, or Kindle's $4. But we are going to have an audio book now. The first one will be kind of AI, and if I see that people are interested in that, then I'm going to take the time and read it myself and do. And that's going to take some time, a little bit of expense because you got to have all the technology set up. But I would highly suggest people read that because it gives great background, and there's a whole chapter on government in healthcare, hospitals. The biggest chapter, the most painful one, is insurance. There's one. So, and then there's the last one is more some predictions, including the 26 contributors about what we can do to fix it. Obviously, I have the podcast. I'll be candid. I'm not sure I'm going to continue it. It gets so little, to me, in my mind, it seems to get so little engagement and viewers that I'm just not sure it's worth my time. I'm willing to do the time, but if people don't engage,
no, it's true.
So I'm not sure. And then my website is just as easy. It's just drbadia.com, drbadia.com. And I think most of my social media is at Badia Hand.
Okay.
So
at
Instagram or Dr. Badia.
Okay.
So like my LinkedIn's at Dr. Badia, I believe.
Okay.
So that's I'm an easy guy to reach. Most people will find that I'm very responsive. I pride myself on that. But you've got to care. And you got to engage. Otherwise, there's no point. This is not a passive profession by any means.
Couldn't have said it better. Last thing we're going to do, doctor, is have a lightning round. Are you ready?
Okay.
All right.
I wasn't prepared for that.
I'm going to ask you 4 questions. You got less than 10 seconds to answer. First question is, what is the best book you have read in the last 6 months?
Elon Musk. Elon by Walter Isaacson, biography.
Oh, I'm checking that out. I didn't even know that was available.
It's a long book.
Okay.
I'm hooked on his biographer, by the way. I'm reading his third one now on Jennifer Doudna. She's the one the main developer with the CRISPR enzyme, the gene splicing and everything.
Yeah.
So that's called Code Hunter.
Oh, that's cool. I'm checking him out. Thank you for that. Okay. Yeah. What is the best TV show or movie you've seen in the last 6 months?
10 seconds. Wow. I just saw one called Your Honor. It's about a judge who has a lot of integrity, but kind of,
I only know that one because it's Bryan Cranston, and Breaking Bad is my favorite show of all time. So I know what you're talking about.
Yeah.
Okay. Now,
if you remind me, I'll send you a drawing. Samuel, email me or something. I'll send you a drawing that my daughter did, a pencil drawing of him.
Consider it done.
Heisenberg.
Yeah. Absolutely. Yeah. I can't wait to see it. And then, best meal you've had. We want the location, the restaurant, and the item in the last 6 months.
Oh, man.
And you're in Miami, so this is going to be tough. I know it's going to be tough.
Man, I just went to a place last week that knocked my socks off.
Okay.
It's right down the street from my center in Doral, which is just west of the airport. And it's called Casa Mariano. Okay. Casa Mariano. It started by an Argentine guy, so you're going to have a lot of good meats there. An Argentine guy and a Bolivian guy. And I'll tell you, I was blown away.
And the item?
God, we had a short rib that he did. We had a fish dish. There were 3 desserts. I tried to avoid eating desserts, but he treated us to that, so I had to eat them. I
Wow.
mean, everything was good. Everything was good. It was amazing. I'm actually going back there Tuesday
Wow.
for a dinner meeting. It was that good.
Okay, that will be in the show notes, folks. So that will be in the show notes. And then last but not least, what is the best experience you've had in the last 6 months?
I can't even go back 6 months, so I'm going to go back 2 weeks. I just did another medical mission in Bolivia. The only critique I had it as there were actually too many surgeons for the number of ORs we had.
Mhm.
So I did some cases, I assisted on some cases, I watched some cases, but that's the first thing that comes to mind. I mean, I think as I already ramping down in my practice, I'm certainly not going to stop being a surgeon, and I'm going to do more and more medical missions
Yeah,
um, as time goes on.
it's amazing. Well, Dr. Badia, it was a pleasure having this time with you today, learn about how you're doing things and all the innovations you're bringing to the world. We can't wait to see what you're going to go on and do. And again, thank you for the time.
Thank you.
And that was Dr. Badia. You know, he's passionate. I love what he's doing. I love the fact that he's put himself out there. I personally believe that the advent of social media is going to continue to change everything, right? Now are the times where one person can single-handedly stand toe-to-toe with an entire organization of over 1,000 people because of the advent of social media. You know, once you create a medium that reaches and connects with people and gives them consistent information that allows them to make better choices, sky is the only limit, which is there is no limit. And I really think that's what Dr. Padilla has put himself in front of. But the reality of that is it's a challenge, right? You kind of have to know where you want to be, what lane do you want to pick? Then you have to know, okay, what actually moves in that lane? Then you have to know what am I saying and how do I need to say it so that my audience can get the most value? You all know what I'm going to say when it comes to getting into medical sales. You know what I'm going to say when it comes to being a better performing medical sales professional. evolveyoursuccess.com. Get there, fill out the application, talk to one of our account executives. But if you're someone out there that's looking to really have an impact with your audience, just like Dr. Badia, again, visit evolveyoursuccess.com, fill out an application. Let's get you to where you want to be. You know, this business is all about getting the right message out there. Yes, we specialize in medical sales, but our passion is getting the right message out there in the most powerful way. And we happen to do it in medical sales because we absolutely love that industry. I absolutely love that industry. But the reality is, if you're someone with a message in the healthcare space, why not collaborate with entities that can help you get the word out? So again, visit evolveyoursuccess.com, fill out an application, let's have a conversation. And make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.